Imagine this for a moment. A single spoonful of a spice you use every day could slowly push your body into a state where a small cut won't stop bleeding, potentially putting your life at risk. This spice is always in your kitchen, but very few people know about its hidden dangers. Yes, we're talking about cloves. We typically use cloves for their flavor and aroma. People use them for coughs, toothaches, or to freshen their breath. But they contain a powerful compound called eugenol, which can affect your body's blood clotting process. This is precisely why it can sometimes become so dangerous. Let me tell you a real medical story. A patient who had suffered a heart attack was regularly taking a blood thinner. The medication was working well, and they were living a normal life. But during the holiday season, they started using a lot of cloves in their cooking. Within a few days, their body began to change. Just 2 weeks later, a minor cut on their hand wouldn't stop bleeding. When doctors at the hospital ran tests, they discovered the patient's blood had become so thin that it was life-threatening. The culprit? Cloves, which had dangerously amplified the blood thinner's effects. So, the question is, should you stop eating cloves entirely? No, a small amount of cloves is not harmful for most people. In fact, they can be beneficial for digestion, colds, and various other issues. However, for those taking blood thinners or other blood-related medications, this is a serious cautionary tale. Experts say, if you're on blood thinners, you must avoid large amounts of cloves. A small amount can be used for flavoring cooking, but consuming a lot daily isn't wise. If you've been using clove oil or supplements for a long time, it's crucial to consult a doctor. Remember, no herb or spice is completely harmless. Each has its benefits, but also its limitations and risks. Using them mindfully allows us to reap the benefits, while careless use can lead to harm. This isn't a rare incident. Every day, millions of people consume cloves in tea, sweets, other foods, or as supplements, completely unaware that they are playing a dangerous game with their medications. These tiny flower buds contain more antioxidants than blueberries and more powerful anti-inflammatory compounds than turmeric. Research has even shown that cloves can lower blood sugar levels by up to 27% and fight infections more effectively than many drugs. But here lies the truly frightening truth. The same compounds that give cloves their healing power can also make your medications and other foods dangerously toxic. The main reason for this is eugenol, which makes up nearly 90% of clove oil. While eugenol gives cloves their aroma and medicinal properties, it can completely disrupt our body's drug processing system. Studies show that eugenol inhibits the liver enzymes that help metabolize over 75% of all medications. This means your small cooking habit could be silently turning your life-saving drugs into health-threatening toxins. There are warnings on drug packages, but not on spice packages. And this is where the danger lies. Today, I'll share a list of 7 things that, when combined with cloves, could land you in the emergency room. These aren't just made-up stories. They happen in real life every day. If you're being treated for diabetes, heart disease, or have an iron deficiency, this information could save your life. So let's dive into the 7 foods and medications you should never mix with cloves. 1. Blood thinners. Researchers at the renowned Massachusetts General Hospital documented a severe reaction to cloves. A patient who was taking the drug warfarin after a heart attack had a stable blood clotting level. During the holiday season, eating spice-rich foods made his condition almost fatal. Daily consumption of clove-infused foods increased his clotting level from a safe 2.5 to a life-threatening 7.8. Cloves are rich in eugenol, which prevents blood platelets from clumping. Studies have proven that eugenol and acetyl-eugenol completely inhibit platelet aggregation. When you combine cloves with blood thinners like warfarin, clopidogrel, or aspirin, it has a double effect on your blood clotting system. Clinical research shows this combination increases the risk of bleeding 3 to 4 times more than taking the medication alone. Even a small amount of cloves used in cooking can dangerously affect the bleeding time for such patients. These effects accumulate slowly in the body. Eugenol's effects can last up to 14 to 18 hours. So, the cloves you ate at night can still affect your medication's efficacy in the morning. Patients who consume cloves daily see a gradual increase in their anti-clotting effects, which can become life-threatening in just a few weeks. The European Medicines Agency's records show that many patients experience severe hemorrhages after eating spiced foods with their blood thinners. This has led to internal bleeding, brain hemorrhages, and a failure for blood to clot during surgery. Unfortunately, healthcare providers often don't recognize this reaction because patients rarely mention their cooking habits to their doctors. People assume natural things are safe, and that's where the grave danger begins. If you take blood thinners, use only a very small amount of cloves in your cooking. Avoid clove supplements or teas completely. 2. Calcium-rich foods and dairy products. Research on indigestion revealed an unexpected link. Patients who regularly consumed clove-infused tea or beverages with dairy products were experiencing unusual digestive issues and mineral imbalances. There's a complex relationship between the active compounds in cloves and calcium absorption. Cloves don't directly inhibit calcium absorption, but they affect the digestive enzymes and beneficial gut bacteria crucial for the proper use of calcium. Studies have shown that the polyphenolic compounds in cloves bind with calcium, reducing its absorption rate and effectiveness. This is highly relevant for those at risk of osteoporosis or those taking calcium supplements for bone health. Furthermore, the tannins in cloves affect the gut microbiome. Beneficial bacteria help convert calcium into a form the body can easily use. Regular consumption of clove tannins can disrupt the balance of these bacteria, negatively impacting mineral absorption and bone health. Many people drink clove tea with milk, thinking it's good for calcium. However, this combination can actually reduce the benefits of calcium. So, avoid consuming large amounts of cloves with calcium-rich foods or supplements. 3. High-fiber foods and digestive medications. A study found that some people who eat high-fiber foods experience digestive discomfort, bloating, and gas after consuming clove-infused foods. Cloves' potent antimicrobial properties disrupt the balance of our beneficial gut bacteria. Research shows that Eugenol can kill both harmful and beneficial bacteria. While this ability is effective against infections, it also destroys good bacteria. These bacteria help digest fiber and produce healthy fatty acids. When you combine high-fiber foods like beans, whole grains, or vegetables with cloves, the cloves prevent these bacteria from properly digesting the fiber. This leads to an accumulation of fiber in the gut, causing excess gas and digestive discomfort. This effect also impacts digestive medications. Those who take probiotics or digestive enzymes may find their effectiveness reduced when consumed with clove-infused foods. Studies have shown that the antimicrobial compounds in cloves can destroy the beneficial bacteria in probiotic supplements within 30 minutes. For digestive health, maintain a gap of at least 2 to 3 hours between eating cloves and high-fiber foods. 4. Diabetes medications. A case was documented in a patient with diabetes. They were experiencing severe hypoglycemia or dangerously low blood sugar, which caused confusion and shaking. They had to be hospitalized twice in an emergency. The patient was taking metformin and insulin, and their diabetes was well controlled. However, they thought drinking clove tea twice a day would be beneficial, but it was what dangerously lowered their blood sugar. The anti-diabetic properties of cloves are well known. A study showed that polyphenol in clove extract could lower blood sugar by 21.5% in healthy individuals and up to 27.2% in prediabetic patients. It reduces glucose absorption from food, decreases glucose production in the liver, and increases glucose uptake by muscles. But the problem arises when these powerful effects are combined with diabetes medications that have the same goal. Clove tea and diabetes medication taken together create a double-down effect on lowering your blood sugar. Studies have proven that the active compounds in cloves have a hypoglycemic effect that lasts for hours, amplifying the drug's impact. The Cleveland Clinic specifically warns that Eugenol can mix with insulin to lower blood sugar to a potentially fatal level. This combination is especially dangerous because its effects vary from person to person. For some, a small amount of cloves can cause a severe drop in blood sugar, while others may tolerate larger amounts. This makes it impossible to determine a safe dose. If you're on diabetes medication, use a very small amount of cloves in your cooking and regularly monitor your blood sugar. Avoid clove supplements or concentrated tea completely. 5. Liver metabolized medications. Researchers at Johns Hopkins discovered a mysterious phenomenon that changed our understanding of the relationship between herbs and medications. A patient who was taking medication for cholesterol and anxiety suddenly found their drugs were no longer working effectively. It was later discovered they had started taking clove supplements regularly. To understand this, we need to know about the liver's cytochrome P450 enzyme system. This complex network of proteins helps metabolize over 75% of all medications. Research shows that Eugenol inhibits several important P450 enzymes. When Eugenol blocks these enzymes, the drugs start to build up in the body. This causes an unexpected increase in the medication levels in the blood, making a normal dose act like an overdose. This effect is particularly dangerous because its results vary from person to person. The outcome depends on how many cloves you consume, your body type, and what medications you are taking. For some, a small amount of cloves can dangerously alter drug levels, while others may not feel any effect with a larger amount. This makes it impossible to predict when and who it will affect. If you are on regular medication, especially for cholesterol, anxiety, or blood pressure, refrain from taking clove supplements and limit your intake of concentrated clove-infused foods. 6. Iron-rich foods and supplements. During a study on anemia treatment, an unexpected issue emerged. Some patients were not recovering despite taking iron-rich foods and supplements. It was later discovered they were consuming clove-infused foods and teas, which was hindering their body's ability to absorb iron. This is due to tannins, the compounds responsible for cloves' bitter taste. Research has shown that tannins are one of the most potent inhibitors of iron absorption. They directly bind with iron in the digestive system to form a compound that the body cannot absorb. If you drink clove tea with spinach or an iron supplement, it can significantly reduce the iron's effectiveness. Since cloves are particularly rich in tannins, this is a special danger. Tannins can impair iron absorption for up to 2 hours after consumption. Therefore, you should avoid iron-rich foods or supplements within 2 hours of eating clove-infused foods or beverages. This is particularly important for vegetarians and vegans, as they get most of their iron from plants, which are more susceptible to the effects of tannins. 7. Alcohol and certain beverages. A study on the combination of traditional spices and alcohol revealed some alarming connections. Some patients experienced unusual reactions after consuming clove-infused wines and cocktails. This included flushing, increased heart rate, and a dangerous drop in blood pressure. The reason is that the eugenol in cloves inhibits a crucial enzyme that metabolizes alcohol. When this enzyme is blocked, a toxic byproduct of alcohol metabolism called acetaldehyde starts to build up in the blood. This causes facial flushing, increased heart rate, nausea, and headaches. Studies show that eugenol can increase acetaldehyde levels by 40 to 60% by inhibiting alcohol metabolizing enzymes. This means a single glass of clove-infused wine or a cocktail can have the same toxic effect as drinking much more alcohol than you normally would. This combination is particularly dangerous. The more cloves, the greater the effect. Traditional holiday drinks often contain high amounts of alcohol and cloves, creating the perfect condition for this reaction. The long-term effects also impact liver health. Acetaldehyde buildup increases oxidative stress and inflammation in liver cells. If you consume alcohol, avoid clove-infused alcoholic beverages completely. A simple plan for your health. After going through these 7 dangerous interactions, one thing is clear. This small clove is much more powerful than we ever imagined. From dangerous blood clotting to hypoglycemia, these incidents prove that natural things are not always safe. This doesn't mean we should stop using cloves. This incredible spice has many health benefits when used correctly. The antioxidant content of cloves surpasses many fruits, and its anti-inflammatory properties are well established in medicine. Our goal is to use cloves mindfully so we can fully enjoy their benefits and avoid their potential dangers. Here's a simple plan for you. First, if you take any medication, such as blood thinners, diabetes drugs, or liver metabolized medications, use only a very small amount of cloves for cooking. Second, maintain a time gap when consuming mineral-rich foods and supplements. Keep at least a 2-hour gap between eating iron-rich foods and cloves. Follow the same rule for calcium-rich foods and dairy products. Third, pay close attention to your body's signals. If you notice easy bruising, unexpected changes in blood sugar, digestive issues, or unusual drug efficacy, inform your doctor. For those with chronic illnesses, consistency is crucial. Your doctor has set your medication dose based on your metabolism and absorption rate. Using something like cloves can disrupt this delicate balance. rendering your treatment ineffective or causing dangerous side effects. If this video helped you or a loved one protect their health, let us know by typing yes in the comments. This encourages us to conduct more research and bring you more important information like this.